The physical decline that began in the 20s continues and is more noticeable. Age-related decreases in vision begin after age 30 years old. The ability to focus on close objects, color discrimination, and night vision all decline with age. By age 40 years, adults have increasing trouble reading small print. They become more and more farsighted between ages 40 and 60. The lens, which is behind the iris and pupil, has thickened and become less flexible. The lens works like a camera lens and is designed to focus light onto the retina in the back of the eye. New lens fibers crowd old ones to the center, resulting in a denser, less pliable, more yellow lens. The muscles that allow focus adjustments by the lens have weakened. By age 50, the lens can only accommodate 1/6 of what it could at age 20. By age 60, the lens can no longer accommodate for different distances at all. The technical term for this is presbyopia. Night vision deteriorates twice as fast as day vision. Yellowing and thickening of the lens, shrinking of the pupil, and changes in the vitreous or transparent gelatin-like eye material all contribute to this decline in dim light vision. The vitreous becomes more dense and opaque in areas, less transparent, reducing the amount of light that reaches the retina. All of these changes in the lens, pupil, and vitreous scatters light and contributes to problematic glare. Oncoming headlights are much harder to reconcile. Color is less able to be discriminated due to the eye changes of lens and vitreous, especially at the green, blue, violet, long wave, low frequency end of the color spectrum. In addition to eye structure changes in the lens, pupil, and vitreous, and muscle changes in the eye, there are also changes in eye neurons. Rods and cones decrease. These are the receptor cells in the retina which receive light and color signals. Optic nerve neurons also decrease. The optic nerve transmits visual information from the retina to the cerebral cortex. Glaucoma involves poor eye fluid drainage that builds pressure, damages the optic nerve, and leads to blindness if not treated. Glaucoma occurs silently without telltale symptoms, so by age 40, adults should be checked for glaucoma with every eye exam. Glaucoma appears to have a strong genetic component and can be treated with drugs and surgery. Age-related decreases in hearing begin after age 30 years, but are not noticed until age 50. The ability to hear decreases first with high frequencies and happens twice as fast in men. The technical name for this age-related hearing loss is presbycusis. Inner ear structures deteriorate with natural loss of cells or reduced blood supply. The loss of taste and smell began at age 60 years. As for the age-related differences with skin, elasticity of the skin decreases more rapidly in women. The middle skin layer, called the dermis, is thinner in women. The dermis is made of supportive connective tissue that bounces back and gives flexibility. The outer protective skin layer is called the epidermis, and it produces new skin cells. The inner fatty skin layer is called the hypodermis and makes the skin soft and firm. With age, the epidermis, the outer skin layer becomes less attached to the thinning dermis, the middle skin layer, and the hypodermis, the inner layer, loses some of its fat and shape. Wrinkles and looser skin result. Forehead lines occur in the 30s. Crow's feet lines at the eyes occur in the 40s. Age spots occur in the 50s. Sun exposure accelerates all of this. As for hair, it thins and grays after the age of 35 years. Muscle and bone mineral decreases, and torso body fat increases in middle age. The abdomen increases 25 to 35% in women and 6 to 16% in men. The muscle decline in the 40s and 50s is gradual and due to the atrophy of fast twitch fibers, which supply speed and dramatic strength. Weight gain can be controlled with regular exercise and a low-fat diet rich in vegetables, whole grains, and fruits. Muscle loss can be controlled by weight-bearing exercise with resistance or weightlifting training included. Weight increases to age 50 with added fat due to decreased basal metabolic rate. Fewer calories are needed to maintain the body as BMR, basal metabolic rate, decreases, but eating habits do not change. After age 60, weight decreases due to loss in muscle and bone mineral. The skeleton. With age, bones become more porous. Cells add on to the outside of bones, but the mineral content decreases. Bone density declines in the late 30s and steps up the decline in the 50s, especially in women. Bone density decreases 20 to 30% in women and 8 to 12% in men. Women after menopause no longer have the protective feature of estrogen on bone mineral absorption, but they can slow by 30 to 50% the loss of bone density with a healthy lifestyle. This means no smoking, little alcohol, added calcium and vitamin D, plus weight-bearing exercise. Height decreases about 2 inches beginning from age 50 years due to the collapse of spinal column discs and loss of bone strength. Weakened bones fracture and break more easily and heal less quickly. Fertility decreases in middle adulthood and is called climacteric. In women, there must be an adequate reserve level of ova in order to conceive. So after age 35 years, infertility accelerates. In men, sperm concentration and motility gradually decrease after age 40 years. There is a gradual reduction of estrogen in women over a 10-year period. The 28-day monthly cycle of the 20s and 30s become 23-day irregular cycles by the late 40s. The climacteric for women ends with menopause in the early 50s. Menopause may come earlier in childless women or in smokers. After menopause, estrogen drops off even more. The reproductive organs diminish, genitals become less sensitive, and vaginal lubrication takes longer. The estrogen loss also makes skin less elastic, bones less dense, and good cholesterol less abundant. Most women experience hot flashes, but not every day or severe. Sleep problems and depression are rollovers from previous issues and are not due to menopause. Hormone therapy to treat menopausal symptoms is controversial. Low doses of estrogen are given to counteract the discomforts of hot flashes and vaginal dryness. It may also make antidepressants more effective in depressed women. Hormone therapy can be estrogen by itself, ERT, for women who have had hysterectomies, or hormone therapy can include both estrogen and progesterone, HRT, to lessen the risk of cancer of the lining of the uterus, endometrium. Mild risks of heart attacks, strokes, and blood clots, and high risk of Alzheimer's and dementia make the decision to take HRT more complicated. Research is still pending on the cardiovascular risks. As long as HRT is not taken for more than 5 years and the woman is of low risk, quality of life may justify its use. The climacteric in men has no menopause equivalent. Testosterone production gradually decreases but is not appreciable in men who are sexually active. Sexual activity stimulates the cells' increase in amount of semen and sperm began after age 40. Middle-aged men require more stimulation to get and to maintain an erection. This is partly because of the reduced blood flow to connective tissue in the penis. By the age of 60, almost half of men have some trouble acquiring an erection. Viagra treats erectile dysfunction by increasing blood flow to the penis. Men should have a thorough medical exam to rule out other causes of erectile dysfunction. Sexual activity drops only slightly in middle age and is more influenced by a stable, happy marriage, positive attitude, and the rate of sex in early adult years. In midlife, sexual arousal and orgasm takes longer in both men and women. Less work and family demands allow for more spontaneity in sexual activity. Middle-aged men are more susceptible than women to major illness. Rates of cardiovascular disease and cancer are pretty even in men. In women, cancer is by far the biggest killer. Hostility and anger, which magnify stress, are personality factors that contribute to vulnerability to disease and illness. 1/3 of all United States deaths in midlife are due to cancer. Lung cancer in men has decreased in the last 15 years, but increased in women. Cancer is uncontrolled proliferation of abnormal cells that interfere with normal tissues. This can occur from germline mutations or somatic mutations. Germline mutation is caused by an inherited predisposition. Somatic mutation happens in a single cell that then multiplies. Environmental agents can trigger mutations or intensify them. Over time, there is more opportunity for exposure to harmful agents. More error is possible in DNA duplications that have repeated themselves so many times with age. The error can be spontaneous or the result of free radicals and their encroachment on the immune system. Men are affected more than women with cancer due to lifestyles or occupation, and to their delay of seeing a doctor. Death rates are linked to SES, with low SES adults more vulnerable. Low SES means poor access to medical care, inadequate diet, and high life stress to get food on the table. Lung and stomach cancers are linked to lower SES. Prostate and breast cancers are linked to higher SES. Nature, nurture, and biological aging all interact to cause cancer. Even if a woman has a defective gene, the BRCA1 or BRCA2, a gene that puts her at greater risk for familial breast cancer, only 35 to 50% go on to develop the cancer. Other factors are at work, like alcohol use, obesity, smoking, number of pregnancies, and use of birth control pills. 40% of cancer victims are freed from the disease for 5 years or more. "25% of deaths which occur in midlife are due to cardiovascular disease. This is a silent killer, as high blood pressure, high blood cholesterol, and artery plaque buildup do not give any symptoms. Left untreated, the first sign that something is wrong may be a heart attack. A heart attack is blockage of a blood supply to the heart from a clot that breaks away from the plaque-lined arteries. Over half die before getting to the hospital. 15% die during treatment, and 15% die in the next few years. This is according to the American Heart Association in 2006. Women may exhibit different symptoms of heart attacks and are often misdiagnosed. They are also treated less aggressively following heart attacks. Men are more likely to be offered angioplasty and bypass surgery. Another sign that cardiovascular disease may be lurking is arrhythmia, an irregular heartbeat. Fainting may occur, or clots may form inside the heart chambers and travel to the brain, causing a stroke. Still another sign of cardiovascular disease is angina pectoris. This is pain indicative of a heart being deprived of oxygen. The pain can be similar to indigestion, or it can be crushing chest pain. Adults can slow the progress of cardiovascular disease or prevent it in the first place by not smoking, by having a normal weight, exercising regularly, managing stress more effectively, and diffusing hostility and anger. Hostility and anger are the factors believed to be influential in the link between type A personalities and heart attacks. Type A behavior is characterized by a sense of time urgency, hostility, and competitiveness. These people are ambitious, hardworking, impatient, always in a hurry, and tense. They walk and fast forward and try to do 2 or 3 things at the same time. They try to do more and more in less and less time. They are often angry and irritable, which raises heart rate, blood pressure, and stress hormone levels. They believe they can overcome any obstacle if they put enough effort into it. Where the risk comes in is in time urgency and chronic anger or hostility. Type A people who also hurry everywhere they go and in everything they do have a self-imposed urgency which produces frustration and anger. Anger and hostility are particularly related to increased risk of heart attack. One research study found that of a group of 250 doctors, aged 25 years old, who scored high in hostility in medical school, were 7 times more likely to die by age 50 than those who scored low in hostility in medical school. There have been news reports that exonerate type A behavior as a factor in heart attacks. Many of these contradicting studies used less accurate ways, like paper and pencil tasks, to classify subjects as type A or type B, type B being a low cardiac risk personality. Type B people are relaxed, easygoing, and do not display time urgency. They are not impatient or hostile and are able to relax without guilt. They play for fun and relaxation rather than to win or be superior over others. Type B people may be just as ambitious as type A people and just as successful, if not more so. Type A personalities would be wise to take their increased health risk seriously. Caution: Personality factors like hostility do not cause disease. Remember that correlations do not prove cause and effect. Hostility and development of heart attacks occur together. They are said to be highly correlated. But there may be a third factor not being considered. Perhaps heart disease and hostility are both caused by a genetic predisposition to react intensely to stress. In addition, personality factors may indirectly cause higher incidences of disease by way of poor health habits, like more smoking, eating on the run, no time for exercise, taking chances, driving faster, etc. Stress management can be very influential in reducing vulnerability to disease and in quicker recovery rates. Coping is the same thing as stress management. It is behavioral and cognitive responses used to handle stress. Coping involves efforts to change circumstances or one's interpretation of circumstances to make them more favorable and less threatening. There are two ways of coping, two ways of managing stress: problem-focused and emotion-focused. Problem-focused refers to strategies aimed at directly changing or managing a threatening stressor. We use this coping mechanism if we perceive that something can be done to change the situation. Clinical techniques are examples of problem-focused coping. Clinical techniques like progressive relaxation and cognitive restructuring. Emotion-focused coping includes strategies aimed at relieving or regulating the emotional impact of a stressor. It doesn't change the problem, but it allows the person to feel better anyway. Defense mechanisms employ emotion-focused coping. Ways to manage stress or ways to cope. We cannot avoid stress entirely, so we need ways to manage it. Some stress is good and motivates people to action. Stress becomes detrimental when it is unresolved or prolonged, or if the person is ill-equipped to handle it. The amount of stress you face is not as important as the way you deal with it, the way you respond. You can diffuse stress by being taught how to directly cope with it. Coping is not a natural skill. It must be learned and practiced like any other skill. There are personal coping strategies to handle stress, things you can do on your own to dampen the effects of stress. Regular exercise is one way. Hardiness is another personal coping strategy. Regular exercise has so many health benefits. It produces chemical byproducts to help counteract and eliminate bad cholesterol, LDLs, and increase good cholesterol, HDLs. It reduces body fat and builds muscle. It promotes resistance to disease by enhancing the immune response, reducing the vulnerability to colds and flu, and reducing recovery time needed when illness does occur. Exercise helps by enabling alteration of other risky behaviors, like habits of alcohol and smoking. Exercise reduces stress, anxiety, and depression. It improves mood, alertness, and energy levels. Salvatore Matti proposes that stress can add to the meaning of life if you have a trait called hardiness. Hardiness is one's ability to tackle stress and profit from it. A life devoid of all stress would be devoid of all challenge and thus be boring and meaningless. Trying to avoid stress by conforming to what others and society expect all the time can lead to boring emptiness. Having a job that is easy and well paid and socializing only with people just like self who have only ideas that agree with your own are attempts to avoid stress. Such a conforming lifestyle may push a person eventually to do dangerous, risky behaviors like drugs and sex affairs to mask the void of a life without meaning. A person with constant attention to the negative side of stress and without hardiness is wrought with nihilism. He or she is always mad, cynical, sarcastic, complaining, and disgusted. What a drag! This person makes fun of positive people with optimism. This brings us to the biggest lesson of all, optimism. We covered it with child development, and the lessons apply here and throughout the lifespan just as well. As for cognitive development in middle adulthood, when you correct for cohort effect, cross-sectional design research shows that crystallized intelligence skills increase throughout middle adulthood. Crystallized intelligence depends on knowledge accumulated through experience and valued by culture. This contrasts with fluid intelligence, which begins to decline in the 20s. Fluid intelligence depends on basic information processing skills like speed of analyzing information and working memory capacity. Schei's Seattle longitudinal study found that middle adulthood is a period of performance at its peak on very complex mental tasks. In midlife, adults are in their intellectual prime. They expand their cognitive competence as they use their vast store of knowledge to solve everyday problems. What they lose in processing speed, physical strength, and dexterity, they make up for in knowledge, experience, practicality, and logical analysis. With age, adults have problems with dividing attention, switching back and forth, and selectively focusing on relevant information. But with practice, they can perform well on all three. As for age-related declines in working memory, these are more evident under pressure, but disappear in a self-paced condition where the midlifer is not timed. These memory declines are due to less use of memory strategies. Retrieval from long-term memory becomes more difficult but does not apply to general facts, procedural knowledge in how to do things, and in facts related to work or occupation. These actually either do not change or change for the better. Thinking about thinking, metacognition, does not suffer with age. Creativity shifts gears in middle age. It becomes more deliberately reflective, integrative, and aimed for societal benefit. Creativity is less about self-expression than it is about altruism, enrichment, and the common good. Midlife adults who are intellectually stimulated on the job with challenging work also choose cognitive stimulating activities on their own leisure time. Cognitive flexibility is as much a part of an adult's 50s and 60s as it is of his or her 20s and 30s. It is never too late to take on college or a new intellectual pursuit. The more you use your brain cells, the better they perform.